Can you guess how many years Tina and I have been married? Stay tuned for this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. Hopefully you can see us if you're watching us on YouTube. Welcome to our podcast, another episode on our podcast.
Another podcast. We just created a whole new podcast.
That's
just
right.
For you.
If you are a regular listener, thank you so much for being a loyal listener. And if you are a new listener to our podcast, thank you so much for joining us. And we hope that you will enjoy this and go and check out our other podcasts because we've got hundreds of podcasts in our library. All right. So how many years have we been married?
Well, we celebrated our 17th wedding anniversary this past weekend.
The year of
Yay.
furniture.
Oh yes, 17 is the year of furniture. We're going to buy ourselves some new kitchen benches to go by our kitchen counter.
That I look it up every year, and every year it just gets more and more ridiculous what they have on there. But apparently, these are things that were done back in the day when people didn't have things, and so every year, somebody put together this system where every year they would get new things to add to their household. And anyways,
apparently,
furniture.
In the 17th year, you need new furniture.
Exactly.
Yeah.
Well, we just got new furniture because we actually were using furniture that we each brought into the marriage over 17 years ago. And so we decided, it's been 16 years last year.
Yeah.
It's been 16 years. We didn't go on any major trips because, we're still getting over the pandemic. Let's get some furniture.
So as part of our anniversary, she dropped off flowers for me at the office, and then I brought some flowers to her at the surgery center along with these big balloons, a 1 and a 7, of course, for 17 years.
Yes.
But when I walked in, everyone's like, "Oh, you've been married for 71 years." And that was like very funny.
Yeah, the thing is the balloons insisted. They continued to move into the 71 position. So I think that's
just meant
good.
to be.
That's
apparently.
right.
Yeah.
That's right.
And then somebody came in and was like, "Oh, it feels like 71 years." I was like, "Ouch." That hurts.
Sometimes being married, she said sometimes being married feels like 71 years.
Dog years.
Dog years, yeah.
Exactly.
Well, I can only honestly say it's only gotten better.
Oh,
I
can't say that, but I'm just kidding.
Hey, there have been rough spots.
Oh my goodness.
There have been plenty of rough spots, but overall they've been good. Obviously, look at us, we're sitting
still
here,
together doing
smiling at each other.
podcasts. Yeah.
And yes, even when we're done with the podcast, it's not like we each flip each other off and say, "I'm out of here." We actually have fun.
Oh, we do.
We actually have a good time. So, anyways, So I guess Tina had an encounter with someone this weekend at church that was amazed that she's almost 60 years old, and so
What? I'm almost 60 years old.
no, my bride is going to be 48 years old this summer.
But
that's right.
Yeah, so this friend of ours at church comes up and he's like, "So, what's new? Anything exciting?" I was like, "Well, Liz and I just celebrated our wedding anniversary." He's like, "Oh, how many years?" I said 17, and he's like, did you get married when you were 2? I'm like, "That's very funny and very kind of you." I said, "No," but I told him, I said, "I'm going to be 48 this year, man." He's like, 48? No way. He's like, "What are you drinking? What's in that water bottle you have?" I said, "Water?" He's like, "No, that can't be it. There's got to be something else you're doing." And I'm like, "No, I'm pretty sure it's just water." Well, it's salts. We do our electrolyte salts, but
Yes.
yeah. The ticket to youthful living is drinking more water.
That's right.
Sure.
But actually, that's so true because, we are a chronically dehydrated population. We really are. Especially in the United States, where you have fancy coffee shops on 2 out of 3 of the corners on four corners of 2 streets. You've got all sorts of energy drinks and all sorts of fancy hydrating waters, flavored. We as a population do not drink enough water. And, we've talked about this in the past. So this is a great opportunity to bring it up again. That a good rule of thumb is that you should be drinking half of your body weight in ounces.
Per day.
Per day. Yeah. So if you weigh 150 pounds, you should be drinking at least 75 ounces a day. And
quick math, Dr. Cruz.
well, thank you very much.
That's very good.
I just picked an easy number. I mean, I should say if you weigh 4 pounds, 2 ounces a day. And here's the thing that I struggle getting the amount of water that I need.
Yeah.
One of the things that I have gotten into the habit of doing that helps a lot though is first thing in the morning. My bottle is the 32 ounce bottle, and it's one of those Gatorade bottles. You just buy them at Walmart. And and one of the things that I've gotten into the habit of doing is first thing in the morning, drinking an entire bottle of water just to get me started. Because if not, through the day as I'm running around, crazy busy doing procedures, I try to drink in between cases, but it's just so hard to get us a good amount of water in. And then I get to the end of the day and I'm like, oh my goodness, I only drank 1 bottle. So if I can start out the day with 1 big bottle, that's a good thing. Then as I go through the day, that's where I struggle.
Gets less.
It does. How do you do?
I struggle too. I've got this water bottle that I use. It's like a 28 ounce water bottle. I'm usually drinking about 3 to 4 of these a day.
That's good.
But there's days where I only drink 2 and I'm feeling it.
Yeah.
But no, I was going to tell you that since my colonoscopy, so I had my colonoscopy used last week, right?
Yeah.
Okay,
We podcasted on that last week.
So I started pooping again on Friday, which is 2 days, right, after my colonoscopy. Yeah.
So proud of her.
And every day since, and normally I poop like once or twice a day, like definitely once, sometimes twice a day. I have been pooping 3 or 4 times a day, like after every meal, like how you should, like that's honestly how you should poop. And because I have been really focused on trying to drink my water so I can keep that up, because I'm thinking, man, can you imagine how full of shit I was before I did this? Because I've been pooping a lot.
And that's what I love about this podcast. We get down and dirty, nitty gritty. You really get to know us.
You really do.
You really get to know.
Now you know our bowel habits, which, we know most of our patients' bowel habits.
Oh, yeah, absolutely.
It's time for us to share our bowel habits with you. And every time I get on the phone with a patient, I'm like, so how often are you having a bowel movement? It's like, do you really want to know? I'm like, yes, I really want to know. Well,
the greatest responses that I've heard through the years, through my over 2 decades of practicing medicine, the normal.
The normal.
I'm like, what's the normal for you? Because everyone's normal is different.
Yeah.
Everyone's normal. For some people, it's normal to have a bowel movement every day. For some people, 2 times a day. For some people, a bowel movement once a week. That's their normal. That's been their normal for, who knows how long.
Yeah,
so
no, it's true.
Everybody has their own normal. But water.
Yeah, so something else I was going to bring up with water. So one of the things I've noticed lately when we go places that have the machines where you can buy the vending machines where you can buy drinks, it's mostly really unhealthy drinks in those things, right? And I've noticed that it's increased, the number of rows of energy drinks have increased, right? Because there's now Bang, Monster, Red Bull, it's like now there's like more brands of these things, and so they're putting these in these vending machines. And I was talking to, and I already know those things are bad for us, like really bad for people. And then the kids are telling me, like our 12-year-olds who are in middle school are telling me that their friends are drinking these things at school. Wow, which honestly breaks my heart. Yeah. Okay, because these things are so bad for adults, much less children. Okay, but we won't go into that. I could talk all day about that. But I had a consult with a guy this week who works for a company that makes the cans for Red Bull and I don't know, one other of the companies. I can't remember the name of it. And he was telling me that he's exposed to chemicals in his job with the cans. And I was like, what do you mean? And he's like, yeah, when the cans come off the line, there's these chemicals and we have to rinse the chemicals off and soak the cans. And I'm like, wow, are you kidding me right now? Wow. Like, I already know the contents of this stuff is bad for you. And now you're telling me, and I would imagine that that's all cans,
Sure.
like soda cans, whatever, juice cans. Like I would imagine that they don't make them differently, right? I just don't realize what goes into the process of these
Well,
products.
you got to think, I mean, these cans, they're like beautifully colored. There's all sorts of marketing, I mean, they're beautiful cans, the Coke cans. So you just got to think of
what they have
the
to
special type of ink, chemical that they use for all that. And so, I mean, that's interesting though. When you told me that earlier this week, I was like, whoa.
Anyway, it makes me want to tell people more not to drink these things, and I told him, I was like, are you protecting yourself from those chemicals? And he's like, what do you mean? And I'm like, well, do you wear a mask or anything? He's like, no. I was like, so you're breathing these chemicals all day? He's like, yeah. I was like, that's really bad for you. Like this, that's the type of person that gets cancer or liver cirrhosis someday just because you're being exposed to those chemicals every day. And he's like, yeah, I don't really care. I'm like, okay. Like, it's just crazy to me. I don't know.
Yeah, I just think that there's I think that there's such a lack of, understanding or even of knowing, the exposure to the things that are out there, the chemicals, the fragrances, everything. I mean, the chemicals that are used even at the surgical center, because the cameras have to be washed. They have to go through a sterilization process. And sometimes I can actually smell some of the chemicals, and I'll tell the tech that's working with me, and they're like, well, I can't smell anything. But I just feel like my olfactory has become more sensitive over the years, and I can just smell these chemicals. Even though since I lost my smell with COVID, I don't smell anything now. I don't smell any
So
chemicals.
even the chemicals you don't smell?
I don't smell them anymore. So, but I mean, it doesn't mean they're not there.
Yeah, no.
But we're exposed to things that we put on our skin, even the lotions, the creams, perfume. Okay, I mean, I love perfume, and there's a perfume that's been like my signature perfume, like since I was in high school. But have you ever looked at the ingredients of a bottle of perfume, all the chemicals in there?
Right.
I mean, you put that on your skin, and where does it go? It goes into your body. It goes into you absorb it, okay? So imagine in our lives the cumulative of all the different chemicals that we're exposed to, not only things that we put in our body, but things that we hold, like you're talking about the cans.
Right.
Things in the air, things in outside. So I think that, and those chemicals get inside. What does your body do with those chemicals? Well, I mean, I think that that's a complex question, and I think that the body does its best to get rid of it however it can. I know for a fact that there are oils that we ingest, like let's say in fried food, that get broken down and that we breathe out, through our lungs. I mean, I'm sure that oil gets broken down and goes out of our body in different ways, but again, the ways that we detox our body, through our urine when we urinate, through our skin when we sweat, when we breathe out, through our poop when we poop, through our lymphatic system. Oh, this is such a great topic.
Oh yeah, we could talk about
Maybe we'll talk some more about detox on our next podcast, because our body detoxes in many different ways, but it does get overloaded and it gets burdened. And so when your body is unable to keep up with all the detox, because we're putting so much into our bodies in different ways, then those chemicals get deposited into different areas of our body, and
that's when we start getting sick.
That's exactly.
Joint pain, headaches, things like that.
That's right. Yeah. That's right. So anyways, listen, we'd love to connect with you. If you're having digestive issues or you just want to reach out to us, you can very easily get a hold of us. Go to our website, drlizcruz.com. If you want a free consultation, and I'm not talking about an office consultation. This is a free wellness consultation with Tina, or we have also another nutritionist, Jaja. But if you want a 30-minute free wellness consultation, go on our website. there's a button there. It's like a magenta colored button. It's beautiful. Click it and get it set up. Schedule it. It's free. It's our gift to you. So please connect with us that way. If you love this show, if you love what you just heard, and please rate us, because when you rate us, it actually will help other people like you find us easier. All right. And if you haven't subscribed, please subscribe. There's a button that you can subscribe to this podcast. That way you will never miss an episode. All right?
Yeah. Awesome.
All right. Well, thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.